Good afternoon, everybody. We're going to get started. My name is Louise Barker, and I'm the Workplace Consultant with the WCB, and pleased to be co-presenting once again today this webinar with Heather Matthews, the OHS Specialist with AWARE, and AWARE is also the host of today's webinar. So this afternoon, the webinar is third of our 3 webinars to support steps 1, 2, and 3 in the Steps for Safety Preventing Workplace Violence. So as a continued support to all of our stakeholders utilizing the Steps for Safety, we're pleased to offer this webinar focusing on leadership and risk assessment. The webinar is going to provide a detailed review of Step 2, and the majority of our time this afternoon will be looking at risk assessment and applying a risk assessment tool based on a scenario. There'll also be some discussion towards the end of the webinar this afternoon on the available material as part of Step 3. So this webinar today is intended for anybody as a refresher who attended one of our original workshops, or for any of those individuals at your workplace that are responsible for implementing these Steps for Safety resources. So if you're joining us again for the webinar, or if you've attended one of our workshops, welcome back. And if you're joining us for the first time, we're really glad to have you with us this afternoon. We will be allocating some time for discussion and a question and answer period at the end of the webinar. So just to recap, the visual that you see are the 3 steps that we have, Step 1, 2, and 3. And we do have that check mark under Step 1 indicating that we hope Step 1 has been completed by your organization, or at least it's in motion and you're taking the steps to complete Step 1. But the Steps for Safety, as you recall, have been developed by a working group representing Health and Community Services. Each of the steps contain the 3 elements: a communication memo, a background document, and a toolkit, which may include 1 or many tools. And the 3 steps that are available to date and that have been published and are on the AWARE website are Step 1, which is your program review and worker perception survey, Step 2, which is the leadership and risk assessment, and Step 3, which are templated policies and procedures. So the first 3 steps really focus on helping workplaces achieve necessary legislative compliance. So Step 2, focusing on safety leadership and risk assessment. We do know that safety leadership is from the top, from every rung in the organizational ladder, and every workplace is key. So everybody in the workplace has a responsibility for safety, but organizational leaders have an enhanced level of accountability. Understanding that workplace safety should be a core competency for all managers and carry real weight in hiring decisions and performance management practices, but appreciating that safety leaders can come from all levels of an organization, and we always need to work together to mentor and champion workplace safety. So when we consider safety leadership, we know that the commitment extends to addressing hazards in the workplace, and the hazards that should be considered include the hazard of workplace violence. We need to prevent incidents from occurring and ultimately improving the corporate safety culture as well. So when we think of the risk factors with respect to violence in the workplace, we know that it's limited to a number of factors, including the nature of the workplace, the type of work, and the conditions of that work. So when we look at the nature of the workplace, this considers the physical aspects of the workplace. So whether the workplace is a building, or whether it's a construction site, or perhaps the workplace is a vehicle and it's a mobile workplace. So when we think about the workplace, we need to look at the lighting, lines of sight, things like the depth of counters, entrances, exits, and objects that could be used potentially to hurt employees. So all of those physical components of the workplace. The type of work refers to the activities that the employees perform. So this is the sector of work. So for us, this is the health and community services and the people with whom our employees interact, be it patients, residents, clients, and also their families and visitors that may also be part of that organization and we'd be interacting with. Lastly, the conditions of work refer to the other aspects such as the hours worked. Is this in the daytime or the evening? The surrounding neighborhood, and whether employees move from location to location or work alone, or perhaps they work in isolation. So we need to consider and recognize all of these different risk factors. So when we think of the risk of workplace violence in different workplaces, we know that there are higher risks for violence when you have certain aspects and certain things that are occurring within an organization. So the list that you see in front of you actually are all issues and all elements that would increase the risk for workplace violence. So whether it's community-based work, transporting people or goods, mobile workplaces, working with individuals with challenging or responsive behaviors, where one person is present, so working alone or working in isolation, providing personal care, dispensing medications, tobacco or alcohol, handling cash or protecting, securing valuables, making organizational change decisions, and having performance management responsibilities. In the health and community services sector, all of these risks are pretty common and are part of the day-to-day work. So essentially this puts us at risk for workplace violence. Knowing that we have these risks and knowing that it's a component within the nature of our work, it's incumbent upon us to ensure that we do a risk assessment to thoroughly identify the risks for the violence and, more importantly, put together an action plan to control and minimize and reduce the likelihood of harm from those risks. So when we have a risk assessment, it is required under the Nova Scotia regulations that in any of the following circumstances, a workplace is required to conduct a risk assessment. So perhaps there's a type of violence that occurs in a similar workplace. So certainly it's not enough if you have not had an incident of violence at your workplace. You need to look at similar organization and similar workplaces, and if it could happen there, in all likelihood it could happen at your workplace as well. If there's a change of circumstances, interactions, location, or layout, so think about the layout of your organization. Have you changed to a more person-centered delivery of care model? Does that change in how the work flows and how the layout of your building, going from a home's different layout within your facility? That would require a risk assessment. If you are developing a new facility, perhaps you've moved, perhaps you have an addition, or maybe you've just renovated an existing facility. All of these really do change the physical components of the work and how it's being done, and again require that you do an updated risk assessment. Perhaps if a Department of Labor officer visits a site, they may order a risk assessment be completed, but if none of these situations have occurred or apply, at a minimum it's required by law that the risk assessment be done at least every 5 years. So recognizing that the legislation came out in 2007, and I'm sure everybody looked to implement things by 2008, that at this point you've either just completed your 5-year risk assessment or you are due to complete a risk assessment, or perhaps you're an organization like many that looks to complete a risk assessment annually. So we hope that the tool could be used and applied for your updated assessment this year. So when we think about your risk assessments, we have a short little video clip to show you. And before we talk about the tool, talk about what it could look like if you had a crystal ball.
Projects. Lead crystal. Custom engineered. Name a project we're bidding.
McChesney Office Complex.
In February, we'll have a crane accident. Shuts us down for 8 days.
Coopersmith.
We've got cost overruns in March from a global spike in steel prices. In April, the credit markets freeze up. We'll have 2 subcontractors going under.
Was this expensive?
A little.
We're gonna be rich. Did we have insurance on that?
Oh, look. It came with a stand.
So a cute little video as a reminder to us that although we would love to have a crystal ball, that's really not the reality. And what we need to do is manage the risk. And for that risk, we really need to plan that out. So the picture in the image is really depicting the process for risk assessment. And the tool that is part of the toolkit for Step 2 walks you through this process more comprehensively. So essentially, a risk assessment involves looking and identifying the risk of violence within your workplace, looking at those hazards, the likelihood of that event happening, the consequences of that event happening, and at that point then looking to develop an action plan or some recommendations to reduce or, if possible, eliminate that risk altogether. So the assessment can be done and should be done with your Joint Health and Safety Committee, and a copy of the final assessment report must be given to them. So the risk assessment includes a number of things, looking at incidents that have occurred and the conditions of the work and the physical layout, which we'll go into a little bit more detail when we look at the risk assessment tool. Our first priority, though, is to consider who will be completing the assessment. You have a number of various options. Essentially, at the end of the day, the employer is responsible for identifying that risk of violence, doing a risk assessment, but you're really encouraged to involve employees, supervisors, and getting full representation from the folks that do the work while they complete the assessment. So it may mean that you involve your Joint Health and Safety Committee. You perhaps may form a subcommittee or a separate committee to complete the assessment. You may already have a risk committee or may want to establish that risk committee team, or perhaps it's a separate management team or a violence prevention team that's formed. We do know, since initiating and implementing the steps, that some local organizations have developed a sub-team, a violence prevention team, and that's the group that has been implementing Step 1, which was the program review, and are now proceeding to implement Step 2 and conducting that assessment as a group. But essentially, you need that, it needs to be more than one person so you have the different perspectives and thoughts and can identify what the risk will be. The risk assessment tool, we're just going to briefly click on for you to see what that looks like as a reminder, and that's on the AWARE website. But you'll see on the tool that the process, the steps 1 to 8 on how you proceed to do the assessment, identifying who, gathering your documents, conducting the assessment, that's all identified on the top left-hand corner of the document. And as you go through, the PDF is once again interactive, so allows you to tick off and fill in information as to what you've looked at, what date you reviewed that information, whether or not that information is applicable or not to your organization, and what your findings are. So as you go through gathering information, you would then proceed to looking again at your risk levels and your severity and probability, and then getting to the nitty-gritty, which is the risk assessment tool itself, looking at each element for your physical environment, some of your measures and procedures, identifying the severity, the probability, assigning a risk level, and where you have some recommended actions populating that area on the form. So the information that you're going to gather, we're going to speak to that in a little bit more detail, and I'm going to hand it over to Heather, who's going to walk you through the information that you may look to be gathering and some of the benefits of that information.
Thank you, Louise. So just to remind everybody, at this point we should, and these things may be happening at the same time. You may be gathering information at the same time you're putting your team together, but it's really important once you gather the information that the team in its entirety go through all of the information. And some of the best things to give you some insight, because you may not fully know, depending on how engaged the committee members are with what types of incidents are happening, and they may know in a general sense, but maybe not specifically on the frequency and the severity of all the incidents that may be happening. So take those incident reports, and you don't want to go back 25 years, but you want to go back a couple of years, enough to give you a sense of what the sort of the environment is currently, because you don't want to go back too far that you're trying to address issues that may have already been fixed through other parts of your health and safety system. The next thing is to look at all your policies, procedures, and practices. And those are all those documents that we produce and we put out there. But we're really going to have to take a closer look at those to make sure, do we have all of those that we need, and do they cover everything they have to? And the next other crucial item is the training record. So what are you training, when are you training, who are you training, and how often are you training are some of the questions you want to ask. As well, you want to look at the JOSH committee minutes, and you're probably going to look at those sort of the same time frame that you may look at for the incident reports, and look at what are the types of things that are coming up, because even though there may not be formal incidents, there may be concerns or other things arise at the JOSH committee members via near misses and just perceptions that the group may want to look at and have insight into. And then, of course, there's the community information. So whether you're in a facility-based or community-based, we're all in communities. So we have to understand what's going on in our communities and how that may impact what we do and how we operate as an organization. And then, of course, workplace inspections. And again, probably the same time period, but look at those and see what things have come up in those that directly feed in to the workplace violence. So I know this is, when we did the workshops, this is a little bit of a troubling slide. It's sometimes hard to get our head around, but what I guess I would say is the more we do it, the easier it sort of comes to us. So it's a common method for ranking risk, since I tend to be tongue-tied on that one. So, and you're estimating the probability and the severity. And when we look at the probability, it's broken out into 5 classifications, and there's different frequency levels of those. And so you want to with your committee, go over this, and you want to customize this to your organization. So even though you may use the same risk names, the characteristics and how you describe that risk and the frequency of that risk may be different descriptors within your organization. Again, the same with the severity. We have it broken out into 4 categories, going from, a very severe, significant event like a fatality down to no injury. And you may already have a risk assessment tool that you use in your organization as part of your occupational health and safety plan and program. And you may choose to use the one that you already have in the organization, or you may choose to use this one or modify this one. I think the most important thing is whichever tool you use, that you use that consistently as you go through this assessment process. So when we take those 5 by 4 categories, you'll see that there's different ways of translating how significant those things are. So if we look at the dark purple, those are the things that have significant impact that you need to address immediately. And you'll see those numbers can be numbers from 4 to 2. So if we just say we're going to do the 4s or we're going to do the 3s, there still may be things because of the because it's very frequent that it needs to be addressed in the larger, more significant category. And then as you move across the spectrum to the lighter purple, that also, it's less risk than the dark purple, but it still requires some type of action. And you too, when you go through this process with your organization, you can determine what things are in the higher categories and what things require what action and who needs to be involved at each of those levels. And then, of course, when you get into the pink, they're lower risk, and they still have to be addressed, but maybe not on the same timeline as the others. So when we go ahead, there was a little news article, and this is just from a couple of days ago, and there was a robbery at a pharmacy in Shubenacadie, and the weapon involved was a hypodermic needle. And I think the significance of this is in healthcare and community services, we are in the same location as medications and other drugs, whether it's narcotics or just other drugs that are used in a recreational manner, but intended for other purposes for the person that's supposed to get them. So that's always a risk. So I thought this did cross over into our realm. So when we think about the risk assessment and looking at this particular case, and just to give you a little bit of a scenario, we look at the task, they're dispensing drugs or alcohol, and because they have drugs on hand, including narcotics, and usually substantial amounts, in this case they got away with a small amount of drugs, but it is classified as a 4, as a serious, because the severity of somebody coming in with a hypodermic needle and not knowing what's in that could quite have devastating effects. So due to the type of incident, and there's a weapon, it's in the highest category of 4, and because of the nature of the medications and drugs that are on the site, and there's people coming in there on a regular basis, that it is likely that that could occur. So that puts us at a 4C, so that requires some action. Now, we're going to show a video. This is the same video that we showed when we did the workshop. And then once we're going to watch this video again just to refresh everybody's memory. And then we're going to talk about and use the risk assessment tool to go through some of the findings that we see in the video. So we'll watch the video here for a couple of minutes.
Hi, my name is Barb Valwa, and I've been a nurse working in home support for over 15 years. The home care visits have many potential hazards, so it's vitally important to always follow safe work procedures. And don't ever be afraid to listen to your gut instincts. Park in a close, well-lit area with easy access. Before you leave the car, review the client's care plan and check in with your supervisor.
Hey, Barb. I'm just outside Mr. Ha's residence. I should be here for the next hour? Okay. Thanks.
It's important that you have safe access to your client's residence. Things such as blocked pathways and unlit porches need to be reported to your supervisor so they can be addressed with the client.
Mr. Ha, how are you?
What do you want?
I'm Marion from Community Care. I'm here to check up on you and give you your medication.
Great, great.
So how have you been doing?
Well, the knees are still killing me, but I'm getting by. I just keep thinking about the on the other stuff, and us. What the hell? Doesn't matter at all.
Have you been drinking?
Oh, what's that to you?
Mr. Haw, if you've been drinking, I can't give you your medication.
Don't give me that shit. If I want to drink, I'll have a drink. It's my own goddamn house. Give me the fucking pills and get the hell out.
Okay, I'm leaving.
You better.
The office will contact you about your medication, Mr. Haw.
You need those pills. Get something.
If at any time you don't feel safe or believe you might be in danger, leave immediately. In this job, you often have to trust your intuition. If you do have to remove yourself, quickly get to your car and drive a safe distance away, and then report to your supervisor. Remember, one of the most important aspects of the job is being able to respond to changing situations. You always have the right to refuse unsafe work. Patient care.
So that's just to remind everyone of the video that we to watch, and for those of you that haven't seen it. And then we're just going to go through the tool. So this is the tool that Louise showed you a few slides earlier. And we're just going to look at, if we look at the outside conditions and her entering the home, and you'll see when we look at the controls, as she was going in, clear sight lines and good lighting, neither one of those, so we have little X's. There was no motion detectors or anything that had the lights come on. And then it wasn't well maintained. She was moving some bushes and some other things off the steps. So when we look at, those are the conditions, and then we're going to look at a severity. So for this one, now mind you, this is just one person's opinion. So when you go through your group and you go through this, this is why it's good to have a committee of a few folks, so you can, people bring different experiences with them, and it allows these to be closer to what the actual results would be. And even though there's multiple questions on this survey, we've just picked 6 to highlight and kind of walk through with you today. And even though we've given you, we've showed this one incident of sort of one visit for us to use as an example of how to apply the tool, but when you're looking at your organization, you're going to look on a much broader scale, and although there'll be things that you'll look at on individual care plans, you're going to be looking at going out in the community in general. So we look at for outside, it could result in serious injury had she had fallen down the steps, for example, and when we move on to the probability, with those conditions and the lighting and the clutter, it's very probable that that could happen. So that gives us a rating of 3B. And then if you reflect back to the chart, it says, okay, well, you need to address that issue. So if we go on to the second question and we look at individual security devices, she did have a cell phone, which we've seen her use. And in this situation, although some of the examples that are on the checklist, keeping in mind when this tool is developed, it's developed both for community and facility-based. So in this situation, a lot of the things around personal alarms or fixed alarms or panic buttons may be things that, you know, could be in either community-based or facility-based. Two-way radios are used in some facilities. But in our situation, she used her cell phone, and the cell phone is the most appropriate tool for the nature of work that she was doing. So we have that classified for severity as a 2, which marginal or minor injuries, and a Class D, which is remote. So as we move along to the next question, which is number 3, and it's about isolated areas and hidden areas. Some restrictions around access to the home. Sight lines are a little distorted. Once she got into the home, the door wasn't locked behind her. So there was restricted access getting in and unclear sight lines, but once she got in, you'll take note that the door wasn't locked and she did enter, and once she got in, the door wasn't locked behind her, so she could quickly get out. And you'll notice that she kept herself between the client and the door, so she had a very acceptable egress to get out if she had to. So when we look at the severity, we had this classified as a 2, resulting in minor injuries just with the nature of, and all the good work I guess she did getting in is helping her if she had to exit quickly. And probability, we have it as a C, the saying that, you know, if she did have to leave, there may be some minor, or the frequency of that happening is quite possible. So that would give us a 2C. So as you go through, and I'm sure you're all saying, well, I would put that at a 3 and I would put that at a B. It's not so much what the rating does help, and we're going to talk about how you deal with that, but it's coming to some sense of consensus with your committee, and it's really talking about, as you go through these processes, what are the controls in place? So what things do we have, what practice do we have, and what kind of things can we put in place to reduce the risk, and that's the main focus of the exercise. The classification, sometimes we get a little hung up on that, and even though that is important, it's really the conversation you have about the risk that's most important. So when we go on to question 4 and we talk about internal and external lighting, it was very poor lighting on the outside, and we have no control, you know, in the home care sector about regular maintenance of lights, and so that's always challenging. And one of the things is, even though people have the best intentions with having their homes well lit, bulbs do burn out, and they may not realize that that has happened. So when we talk about the severity, we have it as a 2 and the probability B. So this you're going to look at, well, what's our communication with the client? Is that covered off in our inspection process? What's the communication back to the client to address those issues when they arise? The next question is question 5, and it's, do employees at time work where there's increased vulnerability, such as late at night, early in the morning, and during quiet times of the day? Now, in healthcare and community services, not necessarily home care. We're there a lot of hours, and we are doing more late nights and overnights with respites now. But most of the times we are 24/7 care, and we are there late night, early mornings. But one of the good, so when we talk about what was in place for the controls, just her whole method of calling in, having your cell phone, checking the care plan, it was very obvious that there was some training in the fact that she didn't, she made sure she had a good way to egress from the building, shows that there was most likely good training and those things happening. And the procedures when arriving, she made sure she did the cleanup on the way in, so if she had to get out in a hurry, that reduced the risk. So I think for the severity of this one, it's a 1 and a 2, or a D, so 1D, so very low risk because of everything that was in place. And then when we look at the last question we were going to look at is, all employees be made aware of using the safety routes and parking and entering and exit the building. Again, this is another one where we could see that she was very observant and handled things appropriately entering the building. She did have her keys in her hand in the car, but she didn't carry that on. When she got out, the keys seemed to be put away. You know, we suggest walking around the vehicle. That's usually done at the start of your shift, so we don't know whether she did that or not. She did have the vehicle locked and the windows up so that she didn't exit and come out to her car and there be any surprises. There seemed to be good lighting on the street, although it was night, so there's always some issues, but there were street lights there. And we made a little bit of assumption that she had well-maintained gas in her car. So again, another low rating, a 1E for this scenario. So now that we've completed this risk assessment, and I know you're all going to wish it was only 6 questions in one scenario, it's a significant amount of work once you've completed all this, and but it's good work that needs to be done. So once we've completed the risk assessment using the tool that we provided, you'll have identified a lot of risks. And you work in an industry where there's a lot of risk, and you've heard me tell the story. You're not in a flower shop, you know, you're in healthcare, you're providing personal care, all of those things that Louise talked about earlier. You're working in the community. So now you want to make sure that you prioritize the high risk category. So those are the things that fall into that dark purple that we talked about in our chart, which is the significant and unacceptable risk. And it's important to remember that when you prioritize them, it's not enough to stop there. So we like to check, did we do the risk assessment? Yes. Did we prioritize them? Yes. But then you have to do something with that, that list that you now have prioritized. And now that you've identified the high risk, then you need to complete the action plan, which is the corrective action log, which is what we provide in the tool, and you see here as an example. And what that does, it allows you to say, what are the recommended actions? Because you've identified the risk. You haven't necessarily, it's during this process that you'll start to identify what needs to happen to reduce that risk. And then you need to assign it to somebody. Because if there's not somebody who's responsible, then it falls through the cracks and it doesn't get addressed. And then the second most important thing to assigning it to a person is assigning a date. So they need to understand what the expectations are for getting those controls in place. And really, once you fill out this log and have everything assigned and the dates assigned, then that's really your roadmap to where you're going to go to reducing the incidence of workplace violence in your workplace. So I know that's a very quick overview, and once you get your team together and you start working through it, it will come a lot easier than you anticipate at this moment probably. So so we've now really moved through step 2. It seems rather quickly, but we're going to now go and talk a little bit about step 3. The good news is when we think about step 3, there's those standard elements that we have with each of our steps. It's always there. There's the communication memo, the background document that's really going to help you distinguish. Sometimes we still struggle with what's the difference in a policy, procedure, and it creates confusion about what's a practice and what's a procedure. So this document gives some language that hopefully helps you in that process of distinguishing the difference between those. So then when we move on to step 3, there's a couple of things when you've gone through the this risk assessment and the program review, you may have seen the establishment of some gaps. So there's a couple of things you want to look at. If you have a prevention policy, there's also requirements of that policy to cover certain things in the legislation. And what we've done is we've provided 2 or 3 templates that you can use to look at and compare yours to and make sure, and if you don't have one, you can use one of these. And we've given sort of a shorter version for those that like it short, sweet, and to the point. And then we have a longer version for those that like to use a lot of words and a lot of language to describe what it is you're trying to do. And it doesn't matter which one you use, they all meet the legislation, but it's important to remember who your audience is and making sure that the policy that you write really gets communicated to them. The other thing we're going to look at is there may be some gaps in policies and procedures. So you may say we're missing some policies and procedures. So what we've done as a working group is we tried to come up with a list of sample policies and procedures. Now this one is a little different than the other tool. We're just having a little technical difficulty. There we go. this one, you'll see we have what the policy is, so working alone, the name of the document, where the document came from, and then the link to those documents. We have several pages of different policies that are at your disposal to look at. So we've done a little bit of the homework and the research for you. And where we've been able to, we've tried to have them come from a healthcare perspective or other significant organizations so that it's good quality examples that you have. Now, we understand that although we have picked some, there may be some as you go through your risk assessment that we haven't addressed or we don't have on our list, and we would just ask that you would share that with us, and we'll look to continue to fill this in. And this is the benefit of having an electronic system, as we can easily update it and get that information to you. And just as a reminder, all of the documents and all of the steps are maintained on the Awareness website, so that you can go at any time and seek any of those information, any of the information we have available. So you can check out our website. We will be loading up the webinars from that we did, the 1 and 2. That'll be on the website very shortly, and then of course this one as well. You can follow us on Twitter for any reminders of updates. They'll also be on our website. And steps 4, 5, and 6 are coming soon, and we're quite excited that in a couple of weeks we should have step 4 out, and we'll make that available on our website, and then we'll have a follow-up workshop for steps 4, 5, and 6 later in the spring. I can't believe we're talking about spring. We haven't got winter, but that's where we need to go. So I'm going to now give you the opportunity, everybody's still there, to ask your questions. Thank you again for joining us today, and good luck in steps 1, 2, and 3, and we'll be looking forward to getting step 4 out to you. So thank you again, and we'll chat soon.
Thank you.